Every year, millions of seniors undergo routine health checkups, believing they are making the right decision. But what if I told you that some of these very tests could secretly increase your risk of a stroke overnight? It may sound hard to believe. After all, you trust your doctor and follow every recommendation. However, buried in the fine print of modern medicine are silent risks, risks that no one warns you about. Not the news, not the brochures at your clinic, and sometimes, not even your doctor. Imagine walking out of your annual checkup thinking everything is fine, only to experience dizziness, blurred vision, or worse, just days later. You may find yourself asking, what just happened? In this video, we are going to uncover the hidden dangers behind the most common tests seniors undergo, showing you how certain routine diagnostic procedures could trigger sudden spikes in blood pressure, disrupt blood flow, and even cause a stroke. Don't worry, this video isn't meant to scare you. It's here to inform you so that you can ask better questions at your next doctor's appointment. After all, after the age of 60, it's not just about catching problems early, it's about avoiding those tests that could inadvertently cause harm. Stay with us as we uncover the hidden risks of common tests and give you the tools to protect your health before your next appointment. If you're over 60, drop a 1 in the comments below. If not, drop a 0 and don't forget to subscribe to our channel Daily Health Guide for more health insights and tips. Let's get started. Contrast-enhanced CT scans are a widely used diagnostic tool that allows doctors to visualize the organs, blood vessels, and tissues within the body with great clarity. For seniors, these scans often become part of routine health checkups, as they provide critical insights into potential health issues like tumors, blood clots, aneurysms, and more. While these scans are invaluable for detecting serious medical conditions, there are significant hidden risks associated with the contrast dye used during the procedure, especially for those over the age of 60. The primary function of the contrast dye is to improve the quality of the scan by making certain areas of the body, such as blood vessels and soft tissues, stand out more clearly. This enhanced clarity can help doctors detect life-threatening conditions. However, what many seniors don't realize is that the contrast dye, while helpful, can also cause sudden and dramatic changes in blood pressure. This can lead to a range of issues, from dizziness and fainting to more severe complications like strokes. One of the most dangerous effects of the contrast dye is its potential to cause a sudden spike in blood pressure. When the dye is injected, it can cause the blood vessels to constrict, which in turn raises blood pressure dramatically. This spike in pressure can disrupt the normal blood flow, increasing the risk of a stroke or other cardiovascular events. Alternatively, in some individuals, the contrast dye can lead to a drop in blood pressure, causing dizziness, nausea, and fainting. Studies have shown that older adults, especially those with pre-existing health conditions like hypertension, heart disease, or kidney issues, are at higher risk for complications after a contrast-enhanced CT scan. For example, a study published in the Journal of Vascular and Interventional Radiology found that seniors who underwent contrast-enhanced CT scans were significantly more likely to experience vascular complications within 72 hours of the procedure. These complications can range from high blood pressure to problems with blood flow in the brain, which can increase the risk of stroke. In one case, an 81-year-old man underwent a routine abdominal CT scan, which came back normal, and he was sent home feeling fine. However, 2 days later, he suffered a minor stroke. The doctor suspected that the contrast dye had caused a sudden spike in his blood pressure, leading to a clot forming and blocking blood flow to part of his brain. This is an example of how the contrast dye, while crucial for accurate imaging, can also create hidden risks that are not always disclosed to patients beforehand. Given the potential risks, it's important for seniors to be proactive in their healthcare. If a doctor recommends a contrast-enhanced CT scan, it's essential to ask questions about whether the scan is truly necessary and whether safer alternatives might be available. In some cases, non-contrast CT scans or even ultrasound exams can provide the necessary diagnostic information without exposing the patient to the risks associated with the contrast dye. Seniors should also ensure they inform their doctors about their health history, especially if they have conditions like hypertension, heart disease, or kidney problems, to help doctors make the best decisions regarding testing options. While contrast-enhanced CT scans are incredibly valuable in diagnosing conditions like cancer, aneurysms, and blood clots, seniors must be aware of the potential risks involved. These scans should not be used as a routine part of checkups, especially for those with existing health conditions. Stress tests, also known as exercise stress tests, are commonly used to assess the heart's ability to perform under physical exertion. This test typically involves walking or running on a treadmill while heart rate and blood pressure are closely monitored. For healthy individuals, this procedure helps doctors evaluate heart function and identify potential risks of cardiovascular disease. However, for seniors, especially those with pre-existing heart conditions, high blood pressure, or other cardiovascular issues, stress tests can carry significant risks. When performing a stress test, the goal is to assess how the heart reacts to increased physical activity. As the patient walks or runs on the treadmill, their heart rate and blood pressure rise. For young, healthy individuals, this is a normal physiological response. However, for seniors, especially those with underlying health conditions, this increase in physical exertion can place unnecessary stress on the cardiovascular system, leading to potentially dangerous outcomes. One of the most significant risks of stress tests for seniors is the sudden rise in blood pressure that can occur during the exercise portion of the test. For seniors with pre-existing hypertension or cardiovascular disease, this spike in blood pressure can be extremely harmful. High blood pressure places additional strain on the blood vessels and heart, and in some cases, it can lead to arrhythmias, irregular heart rhythms, blood vessel tears, or even a stroke. A 2020 study published in the American Journal of Cardiology analyzed over 1,300 patients over the age of 65 who underwent stress tests. The study found that nearly 7% of patients experienced adverse events during the test, including abnormal heart rhythms and sudden spikes in blood pressure. These risks were particularly high in seniors with pre-existing vascular issues, highlighting the importance of caution when performing this test on older adults. One real-life example involves a 74-year-old woman who had a long history of high blood pressure. She was advised to undergo a routine stress test, even though she had no symptoms like chest pain or shortness of breath. Halfway through the treadmill portion, she began to feel dizzy and experienced tightness in her chest. The test was halted immediately, but by the next day, she suffered a minor stroke. Doctors suspect that the sudden spike in her blood pressure caused a small blood vessel in her brain to rupture. Seniors considering a stress test should have a conversation with their doctor to discuss the potential risks. If a senior does not have symptoms such as chest pain or shortness of breath, it may be wise to ask whether the test is truly necessary or if there are safer alternatives available. In conclusion, stress tests can be a useful tool for diagnosing heart conditions, but they carry risks for seniors, especially those with pre-existing cardiovascular issues. Before agreeing to a stress test, seniors should discuss their health history with their doctors and inquire about safer alternatives that may pose fewer risks to their heart and overall health. Endoscopic procedures, including colonoscopies, upper endoscopies, and sigmoidoscopies, are essential for diagnosing gastrointestinal problems. For seniors, these procedures are often recommended for routine screenings to detect polyps, ulcers, bleeding, or cancers. Although valuable for early detection, sedated endoscopies carry significant risks, especially in older adults with pre-existing health issues. Sedation is commonly used to reduce discomfort and anxiety during endoscopies. Medications such as midazolam, propofol, or fentanyl help patients remain calm and pain-free. However, sedatives can depress breathing, lower blood pressure, and affect heart function, risks amplified in seniors whose cardiovascular and respiratory systems are less resilient. Even small changes in blood pressure or oxygen levels can lead to serious complications, including fainting, heart rhythm disturbances, or strokes. Medication interactions are another major concern. Many older adults take blood thinners like aspirin, warfarin, or newer anticoagulants to prevent strokes and heart attacks. When combined with sedation, these drugs increase the risk of bleeding, even from minor tears during the procedure. Delayed bleeding may occur hours or days afterward, which can become life-threatening if not promptly addressed. Another hidden risk is that sedation can mask symptoms of complications. Seniors may not fully communicate pain, dizziness, or confusion during the procedure, preventing early intervention. In some cases, gastrointestinal perforations, a small tear in the intestine, might go unnoticed until the patient is home, delaying treatment. Reduced organ perfusion caused by low blood pressure under sedation can also lead to temporary strokes or cognitive issues, sometimes mistaken for normal aging. A real-life example highlights the dangers. A 76-year-old woman with atrial fibrillation and daily aspirin underwent a routine colonoscopy under moderate sedation. Initially, the procedure seemed uneventful, but within 48 hours, she experienced slurred speech, dizziness, and limb weakness. Doctors determined she had suffered a minor stroke triggered by sedation-related blood pressure changes interacting with her medication. This case underscores how seemingly routine procedures can carry serious risks for seniors. To reduce risks, seniors and caregivers should discuss the necessity and type of sedation with their healthcare provider. In some cases, procedures may be done with minimal or no sedation, using local anesthetics or relaxation techniques. Seniors should also provide a complete list of medications and medical conditions. Proper monitoring after the procedure, whether in a healthcare facility or at home, is essential to detect early signs of complications such as bleeding, confusion, or neurological changes. In summary, sedated endoscopies are invaluable for detecting gastrointestinal disorders, but seniors must be aware of the associated risks. Sedatives can affect heart and lung function, interact with medications, and mask early warning signs. By discussing alternatives, carefully monitoring post-procedure recovery, and understanding potential complications, older adults can safely benefit from endoscopic diagnostics while minimizing avoidable risks. Magnetic resonance imaging, MRI, is a highly detailed, non-invasive diagnostic tool used to detect tumors, neurological issues, and vascular problems. For seniors, MRIs are often enhanced with contrast dye, such as gadolinium, to improve visibility of tissues and blood vessels. While contrast-enhanced MRIs offer precise diagnostic information, they carry unique risks for older adults, particularly when kidney function or overall health is compromised. Gadolinium-based contrast agents, GBCAs, are injected to make tissues appear brighter, aiding in the detection of inflammation, tumors, or abnormal blood vessels. For seniors, however, decreased kidney function can prevent efficient elimination of gadolinium, leading to accumulation in the body. This increases the risk of nephrogenic systemic fibrosis, NSF, a rare but severe condition that thickens the skin, stiffens joints, and can affect internal organs. NSF can significantly reduce quality of life, particularly in seniors who already face mobility challenges. Even in individuals with normal kidney function, repeated gadolinium exposure can result in tissue retention, including in the brain. Studies show that gadolinium deposits may accumulate in the basal ganglia and dentate nucleus, potentially causing subtle cognitive changes or neurological symptoms over time. These effects may be mistaken for normal aging, making them difficult to detect and manage. Allergic reactions are another concern. Gadolinium can trigger mild reactions like rashes or nausea, or severe anaphylaxis in rare cases. Seniors are at greater risk due to polypharmacy and age-related cardiovascular changes. Even minor reactions may escalate quickly, causing dangerous drops in blood pressure or heart rhythm abnormalities. A real-world case illustrates these risks. A 78-year-old man with moderately reduced kidney function underwent a gadolinium-enhanced MRI to evaluate possible brain lesions. While the scan revealed important findings, he developed skin thickening and joint stiffness weeks later, early signs of NSF. His kidney limitations made him more vulnerable to gadolinium's adverse effects, requiring ongoing treatment to preserve mobility. Before undergoing an MRI with contrast, seniors should undergo kidney function testing, such as glomerular filtration rate, GFR, to ensure safe dye clearance. Doctors should also review medications, allergies, and overall health status. If risks are high, alternatives like non-contrast MRI, CT scans, or ultrasound may provide sufficient diagnostic clarity without introducing gadolinium-related hazards. In conclusion, gadolinium-enhanced MRIs are powerful tools for detecting serious medical conditions. However, seniors must carefully weigh the benefits against potential risks, including kidney-related complications, neurological retention, and allergic reactions. Thorough pre-screening, discussion of alternatives, and careful monitoring can help seniors safely leverage MRI technology. Being informed and proactive ensures older adults gain valuable diagnostic insights without compromising their health or long-term well-being. In summary, while routine tests like CT scans, stress tests, endoscopies, and MRIs are vital tools in detecting health conditions, they carry hidden risks, particularly for seniors. The contrast dye in CT scans, the exertion of stress tests, and even sedation during endoscopies can lead to complications that may trigger strokes, heart issues, or neurological problems, especially for those with existing health conditions. It's essential to have informed discussions with your healthcare provider and ask the right questions before agreeing to any diagnostic test. Don't let routine procedures put your health at risk. Always ask, is this test really necessary? Are there safer alternatives? Knowing your options and making informed decisions is the best way to protect yourself and your loved ones. We hope this video has helped you understand the potential dangers behind common medical tests. If you found this helpful, be sure to like, subscribe, and share it with others. Your health matters, and we are here to help you make informed decisions. Subscribe to Health 365 for more tips on taking control of your health.